There was a nurse that you're going to hear explain what happened to her when her supervisor tried to send her to a particular floor in the hospital that's dealing with the virus that's rampaging all over the world. Now, I want you to check out this clip because this nurse isn't the only one that's feeling this way, so let's check that out.
I'm not trying to be unprofessional. I'm upset. I just quit my job. I clocked in, found out that I'm being sent to a corona floor when they know that I have kids at home who I can't send away for, to stay away from me. My manager sent me to a floor that is being tested for corona. She knows my health history. She knows all of this. I quit. I care about the patients and all, but my family and my life, they matter. They come first. Lavika Stewart is evil. She's evil. She knows my health history. I told her my kids don't have anybody to go to while they're here. I can't send my kids away like everybody else. I'm done. I'm leaving. My life matters and my kids matter. Screw this.
If Donald Trump and the federal government don't get a hold to this, you're going to see more and more of this happening in the healthcare industry. I've been watching a lot of videos from nurses and even some doctors have put out. They are becoming overwhelmed with this thing. This is not something that they normally have been trained to do, and they don't really know what to do with the situation other than try to stabilize people, with their symptoms. They're seeing high rates of death around them constantly. One nurse I saw, she was talking about 1 minute she's talking to a guy, next day she come back and they put a sheet over the guy. You know what I'm saying? I mean, it's that serious. And why is it that they don't have a better response for this or how to handle this? Then I saw another story where the New York governor was asking for 40,000 ventilators, and Donald Trump said, you don't need that many ventilators. I'm like, really? I'm like, how do you know what people need? I mean, it's crazy, all the things that we're seeing in this country right now due to corona. I mean, let's call it what it is. It's like, our country has touted itself as the best of everything. We got the best military. We have the best healthcare system. We have the best this, the best that. But then when it's time to show how we are the best at everything, we're not showing it right now because it proves that we didn't have enough ventilators for all these people all over the country. I mean, you have a country of 300 plus million people, and what one doctor said is all over the country you have, maybe 150,000 ventilators? Now Trump is wanting to start scrambling and telling companies to start making ventilators? We should have had all this way before when we didn't need them. It's one of those things that, like they say, stay ready so you don't have to get ready. Well, they wasn't ready for this because they didn't stay ready. I mean, you're seeing that now they're saying that they're looking at to quarantine the whole New York. Right here in my state. They're saying if you come from New York, you need to quarantine for 14 days. I mean, that's how bad it is. And yes, I understand though, if you look at the numbers, the death rate versus how many people getting it is actually a lot better than Italy. I mean, just we're looking at the numbers, but still, we should have been better prepared for this. They had warned that this was coming, and they was not ready for it. And realistically, you can't shut the country down for months. You can't do that. I know people personally who's being affected by this. And the economy, itself, if you shut everything down, completely down for months at a time, you think you got a problem now, you really got a problem by the time you're done. Because you just shut really the money coming in. And the people who work in essential jobs, I mean, that doesn't carry the whole economy. I mean, believe it or not, your restaurants is part of that economy, your movie theaters, your entertainment centers, your hairstylists, all the different people that you have that shut down right now, they are part of that economy. Like small business owners, your farmer's market. Like I love going to the farmer's market on the weekends and going to get some good healthy options, but you can't even do that right now because everything is shut down. But if they don't get a hold of this and don't get help in the medical field, you're going to have more and more nurses and doctors saying, you know what, screw this, I quit. Because let's call it what it is. They're putting their family on the line too, going into those hospitals where all these people swarming in with corona. The doctors as well. Then on top of that, healthcare professionals, by the time they get out of work, to go to the grocery store to get something to eat, and the shelves are cleaned out. People still cleaning out shelves. So I don't understand, prior to this, people weren't cleaning out shelves, but prior to this, people could go to the restaurant too. So I guess everybody eating at home, I don't know. Maybe they don't up their production. They don't have enough coming in. I don't know. But what I'm saying about this is our healthcare workers are overwhelmed. They need help. Or you're going to see more and more of this. And then when you go to the hospital, they say, hey, we don't have enough doctors. We don't have enough nurses. And then people just being left there just to, sink or swim with it on your own. I mean, that's bad. And they're saying that this thing haven't even peaked yet. They haven't got there yet. And man, I'm just shaking my head, because I have a family member that I know that works as a nurse. So I'm definitely concerned about her and what she's dealing with. So, a lot of these stories that we're seeing is very personal, for definitely me and my family. And worrying about if she would be exposed to that and possibly bring that home and all that to her, family. So, to the healthcare workers, like I said, my definitely hats off to you guys. You guys are dealing with a lot. You had no idea you were going to be dealing with this. And unfortunately, the federal government is not providing the things that they should be providing. And Trump want to get mad at governors for saying that, but you're not providing the things that need to be provided. And also, another thing, everybody talking about, oh yeah, we'll get these stimulus. Do you realize that that's a one-time check? Bills will come more so outside that check. Just up north in Canada, Justin Trudeau is giving his people $2,000 a month. But yet here's a one-time check. Why isn't it $2,000 a month? If you know this pandemic is going on longer than that. But see, other countries outside of this one, they do a little bit more for their citizens than this one do. Call it what it is. This country feeds off its citizens. They don't really do a lot for us. I mean, that is, it always shows a one-time check of $1,200 or $2,400 or $500 a kid. One check. Now, if the country will open back up in the next week or two, hey, that's a good thing. But if you plan on having things shut down all this time, do you really think a one-time check is going to get it? No, it's not going to get it. That check will be gone like this, and then people going to need something again. Then they're going to be looking at you like, what's going on? You should have instituted this at least for a minimum of 6 months. A minimum of 6 months. Sometimes you should have maybe instituted that for a year, but minimum 6 months. Because people is not going to recover from this in one check. I mean, it's not just him, it's not just Trump, it's the Republicans and the Democrats. But see, they don't care about the average citizen because all of them are rich. Look at all of their net worth. They go there not being rich, and then all of a sudden they come out, they're millionaires. And that is total corruption in itself. And nobody wants to investigate how they're getting their money. Because that job they have don't even pay $200,000 a year. But yet they come out there worth $5 million, $10 million. How? Well, it's corruption. And they keep that very quiet. But let me comment, let me know something about the situation that's going on with this nurse and, our healthcare professionals being overwhelmed. I mean, because something has to be done. I mean, the federal government needs to step up. I mean, the states can do what they can, of course, but they're supposed to work together. It's not time to be arguing with governors. It's not time for that. Talking about they should be appreciative. No, it's not about somebody appreciating you, Donald Trump. It's not about that. You mean your ego needs to go at this point. No, what you need to do is say, hey, you need this? All right, I got to get it done. That's all people need to hear, is you getting the work done. You can do your ego and calling names later, but people are actually dying out here. And healthcare professionals are being overwhelmed. What are you going to do when people just walk away?